Yeah, awesome. Then take it away.
Thank you. Thank you again for having us tonight. Thank you, PM&R Scholars, for inviting us to the presentation today. My name is Mina Shnuda. I'm one of the academic chief residents of JFK JRI. And the first 10 minutes of our session will have an overview video by our very own Dr. Sarah Cucurullo, who is the chair and program director. And then we'll leave the rest of our time open for you guys to ask questions for the rest of our chiefs and ask any personal experiences from us. That way you'll have a better idea of what the program entails and really have all you need to make a good decision. So without further ado, I'm going to be sharing my screen.
Welcome. My name is Dr. Sarah Cucurullo. I'm the chairman, residency program director, and the medical director for the JFK Johnson Rehabilitation Institute in Edison, New Jersey. We're very excited that you're here today, and I'd like to go through some of the key components of our program. The JFK Johnson Rehabilitation Institute is located in Edison, New Jersey. We are the Department of Physical Medicine and Rehabilitation for both Rutgers Robert Wood Johnson Medical School and the Hackensack Meridian School of Medicine. We are attached to an acute care facility called JFK Medical Center. It is a 475-bed acute care hospital. This is a tremendous benefit to our residents in that we have consultants and medical support for our residents attached right to our rehab institute. Many of the consultants have privileges at both Rutgers Robert Wood Johnson Medical School and Robert Wood Johnson University Hospital, in addition to JFK Medical Center. So our patients that come from these facilities have a great continuum of care. We have a 24-hour code team, and we have many other benefits of being attached to an acute care hospital. I'd like to talk to you about our academic curriculum and then our clinical curriculum. We have a very structured academic curriculum that covers the 12 main topics in the field of PM&R, with which we follow the self-assessment curriculum. Those 12 topics are covered month by month. So each month we cover a separate topic during our protected block time from 8 a.m. to 1 p.m. We have visiting professors, journal clubs, grand rounds for each didactic month that focuses on one particular topic. My topic happens to be stroke, which occurs in September. The curriculum over the course of 1 year covers all the 12 topics of PM&R. So we have the benefit of having our curriculum repeat 3 times during the duration of the residency program. And as I said before, the entire month is committed to each of these 12 major topics, where guest speakers and workshops are built directly into that academic curriculum and our protected block time. Part of our academic curriculum is a senior board review course. It runs from January to June during their senior year. It follows the SAE curriculum that is an extension of our academic curriculum that occurs the 3 years during their training year. And we have published a book, the PM&R board review book, that contains the notes from this board review course. It is covered over that 6-month period of time, and by the end of their training, the residents are ready to take the mock exam and the actual board exam that occurs in August of their post-graduation of their senior year. We do mock exams for part 1, but we also do mock exams for part 2, in which we prep the residents for their oral exams. Other aspects of our academic curriculum include a cadaver course and outside courses, which is a benefit because we are in the tri-state area, so we benefit from some of the strengths of some of the other programs that occur in this particular area of the country. So being in the tri-state area and including Pennsylvania, we benefit from those programs. Within our program, we have workshops that occur, which include spasticity, injection workshops, trach workshops, and we have monthly ultrasound workshops where the residents get 2-hour workshops and work with the sports medicine trained physiatrist boarded in sports medicine, and he trains our residents in ultrasound, which is extended then into our clinical realm. We have research opportunities and a research requirement. Our clinical curriculum, probably one of the most beneficial aspects of our clinical curriculum, is that we have a 1-to-1 attending teaching ratio with individual teaching assessment of each resident. The rotation schedule is formatted to allow the residents to focus on the specific areas of PM&R. Each block is broken into a 3-month curriculum. So we focus during your PGY 2 year on brain injury, cardiopulmonary, spinal cord, and stroke. As you can see, there's multiple different areas in the PGY 3 area as well, and the PGY 4 area as well. Our clinical curriculum, part of the assessment is our clinical competency program that assesses the competency of each resident at the end of each rotation. Each resident during each one of their rotations will get a full clinical competency assessment that will make sure that they know how to do all appropriate procedures and all exams for each one of the individual areas that we cover within the clinical realm. There's ample hands-on experience for all of the procedures that you see listed here, and we not only meet the ACGME requirements for these hands-on experiences, which include EMGs, ultrasound, Botox injection, joint injections, in addition to many others, but they not only meet that requirement, but they exceed it. We have another unique aspect about our program is our 3-month elective. 1 month is allowed out of house, which allows residents interested in fellowships to showcase at other programs. In addition, we have 2 months that are required in-house that allows for research and specialization. We have an optional sports program for anyone interested in sports. They can be involved in high school football games, physicals, and wrestling weight certification. We also have fellowships here that are offered at JFK Johnson. One is an ACGME pain management fellowship, and the other is a brain injury medicine fellowship. Our graduates, about 50% go into private practice and 50% go into fellowships. The recent fellowships obtained here include brain injury medicine at Mayo and Tears program, pediatrics, pain, and sports medicine, all of which are very prestigious fellowships that our residents have matched into. The professional careers that we have for our residents include, as I said, both clinical, and they either do fellowships or they can go into a professional career directly. That includes going to academics, which they can go to any of the programs listed here, and our graduates have also gone into private practice setting. I'd like to thank you for being here today with us to learn about our program. If you have any questions, reach out to our program coordinator, Beth Bolger. Her contact information is there. I'd like to also encourage any of you that may have questions for me to ask, please contact Bev, and I'd be happy to answer any of the questions you have about our program. I wish you all the best in going into the field of PM&R, as it's a wonderful field, and we look forward to seeing you during the interview season. Thank you.
Hi, everyone. My name is Leslie Begay. I am the Assistant Residency Program Director here at JFK Johnson Rehabilitation Institute. What you may not know about me is that I was actually a resident and chief resident here in the Department of PM&R at JFK Johnson Rehabilitation Institute. After graduating, I was hired as an attending faculty member in the Department of PM&R. My clinical duties, most recently, have been include developing and being the medical director of our cancer rehabilitation program, which I'm really excited about. In addition, I get to work with the residents and in resident education as the Assistant Residency Program Director. I also get to work with medical students as the Clinical Assistant Professor, both for the 2 medical schools that we work with, Rutgers Robert Wood Johnson Medical School and Hackensack Meridian School of Medicine. Since I was a resident here at JFK Johnson Rehab, the department is more than doubled in size, both with attending faculty and staff. This has led to the creation of many new programs because of the diverse interests and specialties that our faculty work in. Some of the things I wanted to talk about are our aftercare and stroke recovery program and our cancer rehabilitation program, which follow patients with ongoing rehab needs in the outpatient arena. We also have a very robust concussion clinic here, and our Center for Sports and Spine Medicine provides ample opportunities in musculoskeletal and pain medicine for our residents. Something else I wanted to highlight was that many of our graduates actually stay on and become faculty here at JFK Johnson Rehab. Some start right after residency, like myself, and others go on to do fellowships in other areas and then return and bring their new skills with them. think this really speaks not only to our residency program, but also to our Department of PM&R here at JFK. Some of the things that I really enjoy about the culture of our department include the teamwork, collaboration, communication, and patient-centered nature. Our attendings and residents work together many times on presentations, research projects, publications, and book chapters. Every day, our attendings and residents also work together with our therapy teams, nurses, and other staff to provide the best care possible for our rehab patients. I hope this gave you a little bit of information and knowledge about why I have really enjoyed training at and staying at JFK Johnson Rehabilitation Institute. I hope to meet all of you again soon.
All right. Thank you all for joining us to watch that video. I hope that explained a lot of the program. Looks like some questions might be coming through. Dr. Thomas Salazar will be helping to coordinate those questions, but we first wanted to start off by saying a little bit about ourselves and what we like most about the program, to give you a better idea. So as one of the academic chiefs, I obviously love the academic curriculum of the program and how it's structured. So you learn really well in this program, especially since there's only 4 residents per year. You get a lot of one-to-one time and a lot of focus time with the attendings that you're able to ask them questions, get their experience, and really learn really well from them. The curriculum is repeated 3 times while you're here. Each month has a different topic, and we learn these topics in different ways. There's the SAE portion, and then we have grand rounds, resident lecture, and what's the other one? and journal club that we as residents are the ones leading. And we learn by teaching the other residents. And we have a attending faculty who supervises us, and really using our resources and the Red Book that Dr. C has authored really gives us the best opportunities to learn and grow in the field.
Hey everyone, I'm Thomas Salazar. I'm also one of the chief residents. So what I really love is all the sort of extracurricular activities that we have within our program. Like Mina was saying, we have the board review Red Book from Dr. C. She pours all of the funds from that she earns back into the program. So all of the conferences are all paid for. So this past year I went to AAPM&R, I went to AAP, I went to AAPM, the American Academy of Pain Medicine, without paying a single penny, which I think is pretty unique to go to that many conferences. We also have monthly ultrasound courses via the New Jersey Society of PM&R that we can also go to. And then we go down to Philadelphia, which Dr. C mentioned in her presentation, for a gait and orthotic course, a EMG course, a prosthetic course. So there's a lot of other things that we get at this program that I really love.
Hi guys, so my name is Eric Liu. I'm one of the co-academic chiefs. So one of the things I love is actually our call structure here. So we do home call, which I think is a huge plus. I love my apartment. I never want to leave. So kind of taking call from home is, I think, a really nice benefit. Also kind of the breakdown of call. So I think no matter where you go, as you guys are probably realizing, PM&R, even outside PM&R, is that, calls can be loaded more towards the first years, the second years. So when you come here as a second year, as a PTY2, you're going to do 7 call weekends. The call weekends is from Friday night to Monday morning. So you're doing the entire call. It's really not that overwhelming at all, completely manageable. You have a backup call resident in case things get a little bit busier. But as a 2, where you're going to have the most weekend calls, you're doing 7. It also means you're going to have 45 other weekends completely free to yourself, which I think is amazing, to either kind of, rest, relax with family, friends, or kind of pursue your own academic interests. So as a second year, kind of like what Thomas was alluding to, I spent a lot of time kind of volunteering at marathons, pursuing workshops, especially ultrasound workshops, working on case presentations, which was, I think, really, really nice.
Hey guys, my name is Mina Gayed. I'm one of the administrative chief residents. Something that I really liked about our program was the fact that we have one-to-one attending resident ratio. So we work with attendings who are specialized and experts in their particular scope of PM&R, and they're always engaged in resident learning. And as a result of working one-on-one with them, we end up getting hundreds of procedures under our belt by the time that we graduate. And so that one-to-one attending ratio really works out in our favor. And so we're pretty good clinicians by the time that we graduate.
Thanks, Mina. So now we're going to get to some of these questions. So I see the first one, are there opportunities to be involved in sporting events? I'm going to send that one over to Eric because he's done a whole bunch of that.
Yeah, so I mean, I think there's usually our residency group, there's always a lot of interest with sports, pain, sports and spine, maybe a combination of both. So for us, we offer football coverage. We do 2 high school football teams. We cover all their home games. It's really nice. Usually, every Friday, usually Friday evenings, we'll have 2 residents sign up to kind of take care of each team. Usually there's enough to go around we're pretty fair. So each resident gets exposure, all 3 years. We also have the ultrasound curriculum that Dr. Cucurulo kind of mentioned earlier. It's a monthly thing. Every month we do about 3 hours of ultrasound, and then available, we have a really close connection with the NJS PM&R with Dr. Stiddick. So he does the monthly ultrasound on one specific joint. We usually have a few of us, we carpool together. It's like 45 minutes, just really nice supplemental learning. And like I said, with the call weekends, you have most of your weekends free. My last 2 years, I spent a lot of time going to either New York City or Philly, really just volunteering at marathons, relays, and any other sporting events, really.
Yeah, I think it's nice where our location is. We're kind of equidistant between Philadelphia and New York. So Eric did the New York City Marathon and also was going to do the Penn Relays before it got canceled this year.
Can I give you guys the 2-minute warning?
What is it like to live in Edison? So I think out of the 4 of us, only one of us actually lives in Edison. That's Mina Shanuda.
Yeah.
New Jersey's pretty suburban, but like I said, we're pretty close to the cities. I live in Jersey City along with Mina Gayed. Eric lives in Rahway, which is about 15 minutes from the hospital. A lot of these suburbs do have really nice downtown areas, and they also have train lines that have access to both cities. There's also a bunch of residents that live in New Brunswick, which is where Rutgers is. Moving on, do we get a post-call day with home call? Unfortunately, we do not. Are there opportunities to moonlight? There are not.
Over weekends, you are paid for any admission that you do. And sometimes the attending, depending on the attending, most attendings will help you out a little bit by giving you a little bit just to supplement, the amount of work you put in for putting the notes and stuff like that. So we don't have moonlighting, but we do have other ways to make money in our weekend calls. So personally, I've taken extra weekend calls to make a little bit more money. So you have that option.
That is a really good point. Thank you so much for pointing that out, Mina. Can we talk a little bit more about the community and collaboration at JFK Johnson? What kind of support you get from nursing and case management? Mina G, do you want to just touch on that for us?
So our nurses are specialized rehab nurses within the scope of caring for cardiac patients, stroke patients, spinal cord patients, brain injury patients, and general rehab patients. Our case management team works closely with us. On our inpatient side, we have the weekly team rounds where we collaborate with the nursing staff, the therapy staff, as well as case management. And we kind of come up with, appropriate plans in terms of what kind of assistance the patient's going to need upon discharge, and kind of coordinating their care that way.
All right, great. Well, I think we're about out of time. I just wanted to say I shared our Instagram and our Twitter on there. That's where you'll be able to see a lot of our life at JFK. I also shared the Google Drive that PM&R scholars put together. We have a bunch of documents like our schedule, a bunch of our research projects from the last year. So take a look at that. And then I also just put our chief's email account in there. If you guys have any questions at all, feel free to email us. Feel free to message us on Instagram or Twitter. We would love to get to anything else that we didn't get a chance to. And thank you again to PM&R scholars for putting this together. We appreciate it.
Thank you.
Well, thank you guys for coming tonight. That was a really good presentation, and quite a few of you on the chat too. So thank you. I think might have been some more questions in there. Like they said, they put their emails in there. They put the email account for the chiefs in there. They put all the information on our Google Drive. So if any other questions you guys have, please refer to that. And then definitely follow them on social media. You know, that's kind of how all of this is coming together. So we're definitely supporting that. Once again, thank you.